Nearly 1 in 10 newborns in the U.S. are born premature. It can happen even if parents follow the doctor's instructions to the letter, but many parents don't have access to the proper care, and the consequences can be life-threatening. In its nationwide report card last year, March of Dimes gave the U.S. a D+ for its rising preterm birth rate, which hit a 15-year high. Also found in the survey were constant racial disparities, which were only made worse by the COVID-19 pandemic. The group is set to release its 2023 report card later this week during National Prematurity Awareness Month and on World Prematurity Day. The director of Maternal Infant Health at March of Dimes, Chloe Schwartz, joins me right now with a preview of where things stand, along with Farida Yada, research assistant at the Tufts University School of Medicine's Mother Lab. And Stephanie Shine is a NICU nurse at Brigham and Women's Hospital and the mother of a preterm child. Welcome, all of you. Such an important conversation. And I do want to tell our guests that I am a board member of the March of Dimes, but this is certainly an extremely important conversation to have because this is an issue that touches so many folks. So Chloe, I want to start with you. This is not, reassuring in terms of women who are wanting to bring children into the world, birthing people bringing children into the world. And I'm sure a lot of people are surprised that in the United States, the richest country in the world, we have a D+ rating.
Yeah, you hit the nail on the head there. It's not reassuring in the slightest. The statistic that I always reference, which really gets people attention probably for the worst, is, if I were to give birth this year, I would be 50% more likely to die than my own mother was 1 generation ago. And that is the same for everyone in the U.S. right now. Outcomes for moms especially are getting worse, but we're not seeing great improvements for the health of babies either. And preterm birth is the co-leading cause of infant death in Massachusetts, and it's the leading cause of infant death in many states across the U.S. And it's not just a national crisis, but it's an international health crisis. We don't necessarily know the cause of a lot of preterm births, but it's not getting much better in recent years. And as the report referenced last year, it was the worst preterm birth rate for the country as a whole that we've reported since we started these report cards. So yeah, definitely not reassuring.
Yeah, absolutely. Farida, in working with mothers through the School of Medicine and then also on research and data on changing these outcomes, what are you hearing about their interactions with their healthcare providers?
So for Black women specifically in the United States who have the highest rates of preterm birth, we're hearing things like their feelings being dismissed, their symptoms being ignored, their treatment being delayed, which is obviously exacerbated by structural racism and experiences of discriminations within the healthcare system.
Yeah, absolutely. And we want to pull up data on that right here. We have from the March of Dimes report card 2022, Black and Native American women, 62% more likely to have preterm birth, and their babies are twice as likely to die as compared to white women. And additionally, over 21.1% of Black women and 26.8% of American Indian, Alaska Native women in the U.S. do not receive adequate prenatal care. So is this an access to resources issue, or does it not matter in terms of socioeconomic status and where you live in the state?
It does matter. A lot of it, frankly, does have to do with a lack of access to quality healthcare services. We know that in the United States, specifically states and counties with higher proportions of Black residents and therefore higher proportions of Black birth have lower access to maternity care services, and a lot of them live in healthcare deserts. And there have also been lots of labor and delivery unit closures affecting a lot of Black and brown people.
Absolutely. You know, Stephanie, as we mentioned in the intro of this segment, you know, you can do all the right things and still have a preterm baby. My son was born at 35 weeks, and I know exactly how that feels, having him hooked up to different machines and just sort of that constant hum of machines in the room. You're a NICU nurse and you had a preterm baby. Talk to me about that balance of knowing, I guess to some degree, what to expect when he's born, he or she's born young, but also, or early, but also, you know, still being the mom that goes through that.
Yeah, I mean, your life will be changed forever, I would say, that you'll, it's something you really can't imagine. And even as being a NICU nurse who had taken care of babies for 8 years at the time and seen so countless families go through this, I really couldn't imagine what it was like to have my own baby be born at 26 weeks. My son only weighed 1 pound when he was born. And I was actually scheduled to work that night, but had to call out sick so that I could deliver. So it comes very unexpectedly. No one ever expects to join this club of being the mother or father of a premature baby. And there's so much that comes with it that so many daily traumas of just being separated from your baby, not being able to bring them home, seeing them go through so many painful procedures, and then all the things that come afterwards, after you bring your baby home. It's not really over once you leave the NICU, and it can carry on for years. So the impact is far greater than I, even as a NICU nurse, ever could have imagined.
Yeah, one GBH News report shows that medical bills for people who are born preterm total $17 billion every year in the U.S., and much of that cost is borne by Medicaid, a taxpayer-funded program that covers nearly half of all births in the United States. But once economists add that medical care for the mother, that price tag for things like special education, if that happens, lost wages, productivity, because we know that preemies have, you know, other things that they have to deal with, especially those with disabilities lasting into adulthood. The annual cost for that actually swells to $25 billion. You mentioned you had to call off your shift in order to give birth, and I imagine that was a balancing act for your family as well.
Certainly it was, and I actually, at the time, went back to work about 3 weeks after he was born and worked while he was in the NICU in order to protect my paid time off for when he came home. I'm happy to say that Massachusetts is now, with the PFMLA, that's actually far improved, and we actually have much stronger paternity leaves now, which has been great. My son is now 10, and I've seen the impact of that, which is great. So, yeah, I think that, and the balancing act of having to actually work when your child is critically ill is nearly impossible. So, yeah, I think that the stress that families go through to endure these hospitalizations is, you know, insurmountable. And as we, you know, since I've started, we're able to push back the age of viability. So when I first started working as a NICU nurse, it was about 24 weeks, sometimes 23, and now it's about 22 weeks. And these can be 6 month to 1 year hospitalizations. So it's, you know, it can be extremely trying on families, and it requires a lot of support.
So, Chloe, as we think about World Prematurity Day, National Prematurity Month, there are so many factors that affect every aspect of everyone's lives, you know, whether you're going to be having children or not. Like we just talked about economists connecting those dots as well. So important to really shine a light on what's happening here.
Oh, absolutely. And, you know, maternal and infant health is one of those things that, you know, in today's world, it's getting a little bit more attention. Historically, that hasn't really been the case. And so instances like World Prematurity Day on November 17th and Prematurity Awareness Month, you know, it's only the 20th anniversary of it, which is a really great milestone, but it hasn't received the same attention that other, you know, sectors of healthcare and medical progress have received. And I think that's demonstrated in the lack of progress we've seen in the different health outcomes. But we love World Prematurity Day because it means that we get to talk about all of the great work that not just March of Dimes is doing, but all of our other partners across the country. We get to all dress up in purple because that is the color for World Prematurity Day. Boston landmarks light up purple in honor of it as well. And it's really wonderful to see everyone come together on something like that.
Yeah, absolutely. Farida, talk to me a little bit about the Mother Lab and the work that you all do to uplift, moms of color in this space, because we know that the preterm birth rates are really high among women of color. We've just talked about that.
Yeah, so under the Center for Black Maternal Health and Reproductive Justice in the Tufts University School of Medicine, we work to protect the Black birthing experience by advocating for quality, equitable, and respectable care in childbirth. And the center seeks to create a world where Black women can safely and efficiently and comfortably receive equitable access to reproductive health services, labor and delivery care without having to navigate through racism and discrimination. One of our current projects at the Mother Lab addresses the perceptions of maternal morbidity and mortality statistic from a patient and provider perspective. And our goal with that project is to give Black moms opportunities to feel empowered during the pregnancy, labor and delivery, and postpartum period.
Absolutely. So such important work that is being done, and especially as we look at things like the clinical trials. We just put out a GBH News analysis that found that clinical trials on preterm births lag far behind other conditions. So, for instance, as part of this quote we're going to put up, it's kind of lengthy, so I'm going to truncate it a little bit and say that there are more drug trials for erectile dysfunction, their prematurity in pregnant women, 15 times the number of clinical trials about breast cancer than about preterm birth in women. And there are more than double the number of clinical trials about infertility than preterm birth. What would be your message, Chloe, for folks to be thinking about the long-term impact of these outcomes? I know the March of Dimes is putting out their own report this week, but there's a long-term impact when we continue to see that the money, the will, the, social consciousness around this may not be here where it needs to be.
Yeah, I think it's made progress in recent years, but you're right, it's still not where we want it to be. Medical advancements have been made in many ways, but the outcomes still aren't catching up. And so there is a lot of work to be done. My message to everyone, would be, and this is a much bigger conversation on where is this investment in maternal and infant health coming from, and how can we grow it? And, March of Dimes is an 85-year-old organization. We hope that, our message still resonates with a lot of people, based on our historical legacy. And we've had many great accomplishments in the world of birth defects and preterm birth, and really just infant health and family health at large. But there's so much more to be done, and so many different ways to impact that work. You have organizations like Mother Lab doing this amazing research. We have organizations like ours, also doing some research, but also really leading some of the advocacy efforts on Beacon Hill and on Capitol Hill and across the country as well. There's no one single solution, and it takes a village.
That's true. And Stephanie, in our last 10 or so seconds or 20 seconds, what would be your message to other moms with preemies? I know you and I have had conversations about it ourselves, with James being born early. What's your message to moms?
Yeah, I think that while the journey is incredibly hard and you never imagined that you would find yourself there, what you will find is that these babies are so incredibly resilient, and they are so much stronger than you can ever imagine such a tiny little human can be. And they will usually far surpass your expectations. So I find that most moms are really surprised by how strong their tiny little baby can be. and to just hold on, keep moving.
Yeah. All right. Very well said. Well, Chloe Schwartz, Frida Yada, Stephanie Shine, thank you so much for your time.